Hi, and welcome to Fairview Range Focus. I'm David Hall. I'm excited to bring our program to you today. We're going to talk about cardiology. It's a new program that's been in development for some time at Fairview. And so we have 4 guests with us today who are going to tell us a lot more about the program. So to my right is Dr. Dan Brody, cardiologist, and to his right, Kristina Conner, to my left, certified nurse practitioner, yes. And Kristina Liesmacki is to the right, who is an RN, and Susie Seikkinen, who is an LPN. So, as we have said, people like to know a little bit more about us and our background and what you do and your years of service. So, Susie, why don't you tell us a little bit more about yourself?
Okay, my name's Susie Seikkinen. I've worked at the Mesaba Clinic for 20 years. I've worked in various departments, including family practice and pediatrics, and now I'm in cardiology, which I'm very much enjoying.
Good.
Yeah.
And what do you do exactly?
So I'm the intake nurse. I'll bring the patient back to the room. I'll take their vital signs, which include their blood pressure, their pulse, their oxygen levels. We'll talk a little bit about what medications they're on, their allergies, if they've had any previous surgeries or cardiac surgeries, if they have been to a prior cardiologist, and from there, Kristina will come in the room.
Okay, nice handoff. So, Kristina, tell us about you.
I'm Kristina Liesmacki. I've worked for Fairview for 12 and a half years. I spent the majority of my time in ENT and allergy, but decided to branch out a little bit and join this group, which I'm also very happy and excited about.
Okay.
And part of my job is to work directly with the provider and kind of facilitate the visit, do some patient education, coordinate any testing, any procedure they're going to have, whether it be here at Range or any outlying facility.
Okay. Perfect.
Yep.
Thank you.
Thank you.
All right. And Kristina, you're a certified nurse practitioner.
That's correct.
Okay, so tell us about you.
So I'm a family nurse practitioner. Dr. Brody and myself work for the University of Minnesota Cardiology Services here between Hibbing and Grand Rapids. My training is out of Duluth, Minnesota as a family nurse practitioner. I have experience in emergency medicine as well as family medicine.
Okay.
And I'm very excited about being part of the cardiology program here and seeing patients in this area.
All right, good. Last but not least, Dr. Brody. So
I'm Dr. Dan Brody, so I've originally from the Twin Cities area, moved up here, spent some time in Virginia as a younger, in my childhood, really enjoyed it. This opportunity came up through the university and I was really excited to take it. So I have 3 kids and I have a wife. As far as training, to get here, it involves 4 years of undergraduate, 4 years of medical school, a year of internship, 2 years of residency, and then 3 years of fellowship. So
that would make you about 55, I think. Right. Okay. That's a lot of years.
It is.
Yeah.
Yes. Quite a few years to get through it.
All right. Well, we're thrilled to have you here and part of our community, and the cardiology service is certainly definitely a needed program, obviously.
Yes.
So maybe you could tell us a little bit about, or someone to tell us a little bit about cardiology, as far as just exactly what is that entail?
So cardiology is a branch of medicine that specifically involves the heart itself.
Okay.
In cardiology, we like to focus on the prevention and treatment of disease that affects the heart and the vasculature.
Okay. So are there different types of cardiologists? I've heard that term as a medical specialist for quite some time, but I think there's different levels, is there not?
Yeah, if you don't think you've gone through enough training, you can go on to more additional training.
Wow.
And there's about, you could actually break it down into 7 different groups. There's electrophysiology, which deals with the electrical system in the body. So those are the people that deal with pacemakers, and if you have an irregular heart rhythm, they can actually treat that with something called an ablation, which is a procedure to zap that area of irregularity.
Okay.
There's also interventionalists. Those are people that were to have a heart attack and need a stent per se. Those are the ones that place a stent and go in and intervene in that situation if you have a severe heart attack. There's congenital cardiologists. So let's say you're born with maybe a hole in your heart, or sometimes the vessels can be misplaced. And they're the ones that focus on those different things, those areas. There's people that do imaging, strictly imaging. So there's echocardiograms, which is a way to look at the heart. And they also look at, we call nuclear, which involves basically a chemical to visualize the heart. And these people specialize, and that's what they largely do, read those. There's general cardiology, which is myself, so you kind of see everybody and then decide if there's more specialized treatment needed at that point. Some of the areas that people are probably more familiar with is cardiothoracic, so that's the surgeons that actually do the open heart surgery. It's a different area of cardiology. And then there's pediatric cardiology, so somebody up to age 18 would be seeing a pediatric cardiologist. In addition, there's heart failure, so people that have a heart function that maybe is weak for one reason or another, including heart transplant and devices to assist the function of the heart. There's that type of physician that specializes in that, so
Okay.
yeah.
That is a lot of different levels.
Yeah.
So you said
Yeah.
you're a general cardiologist.
General cardiologist,
So
right.
would that be, commonly what someone entry level? I mean, as far as when they first started having a cardiology issue, maybe?
Correct. Yeah. A lot of times you start off seeing your primary care provider. If it's a cardiac specific issue, you see a general cardiologist, and then referred to one of these more specialized cardiologists. And that's
Okay.
the process. Yeah.
Would you, if someone saw a different type of cardiologist, may they come back to this community and be seen by you to continue their treatment in conjunction with someone else? Or?
Absolutely.
Okay.
Absolutely. Yeah. If you have a procedure done, you refer back to the, your regular cardiologist, and they follow up on that and see if there's any changes that may need additional treatment.
Okay.
Yeah.
All right. Excellent.
Absolutely.
So, who needs to see a cardiologist?
It's a great question. Generally we break it down in a couple different areas, but we say people that have had like family history, they've got a strong family history of heart disease and they're concerned about that. People that have had family members that have had heart disease and maybe they're at risk for heart disease as well. Certainly somebody that's had a heart attack in the past, so somebody that's had some type of procedure to repair that, whether it be open heart surgery or stenting, needs to be followed up on a regular basis. If there's concern for, sometimes people have palpitations or rhythm issues, things like that, I think it warrants a evaluation by a cardiologist. Somebody with heart failure, somebody that has a weak heart, which can present as shortness of breath and swelling to the legs, definitely need to see cardiology. Another area of cardiology that's not as well known is if people have pain in the legs with walking and things like that. Cardiology, certain branches and certain interventionalists can actually do procedures to restore flow within arteries in the legs and the neck and things like that. So,
Okay.
Yeah.
You mentioned heart failure.
Yeah.
Some people might hear that and think, does that mean when the heart stops? What exactly is heart failure?
So heart failure is the heart's still functioning. It hasn't stopped.
Okay.
It's a situation where the heart is weak from a number of different causes, which causes the heart just not to pump quite efficiently and effectively.
Okay.
So, which results in some fluid backup.
All right. And is that often a chronic problem, or is it an acute, just short term, or?
It can be a chronic problem.
Okay.
It depends on what the cause is, and that's why it's important to see cardiology, see if there's something that can be done to improve that.
Okay.
Absolutely.
Good. Thank you for explaining that. What about risk factors? I hear a lot of things about risk factors for lots of different things, but in regards to cardiac health, what are some of the risk factors?
Sure. In cardiology, there's quite a few risk factors. Some we can control, some risk factors we can't. Risk factors that we can't control might include, your age, gender, your family history, your ethnicity. Things that are more modifiable for risk factors include tobacco use, treating your diabetes if you do have that, and managing that, treating hypertension.
Now, what is hypertension?
High blood pressure.
Okay.
Other risk factors would be, if we're living a lifestyle that we're sedentary, or we're not exercising, or we're not eating an unhealthy or a healthy diet.
Okay. That's a lot of things.
Yeah, it is.
Okay. And you mentioned diabetes, so there are other diseases that one might have that could have an association to cardiac health?
That's correct, yeah.
Okay.
That could be more likely to influence cardiac disease.
Okay.
Or put you more at risk
Okay.
for things.
How about age? Is there a particular age that, you know, if I'm less than 30, I don't have to worry about cardiac issues? If I'm over 50, I do? Or
Right. Well, the American Heart Association says that at age 20, you could start being evaluated for
Okay.
these risk factors. You know, things in office starting at that early age could include blood pressure monitoring, checking weight, your body mass index to see where you fall on that chart. Anything from checking your cholesterol, getting those fasting lab values, checking your glucose, and looking at more of those prevention pieces early on.
Okay. So you mentioned weight, and I think that's often mentioned in regards to lots of different diseases and so forth. How help us understand, so how does the a person's weight affect their heart? Is it, I mean, it sounds like being too heavy would be a greater risk than from a heart disease standpoint.
That's correct. Yeah, it can directly affect the workload on the heart as well.
Okay.
There's, you know, the piece of the dietary that is involved in that. Well, it kind of ties together, and the development of cholesterol, and that can lead to heart disease and risks that are associated, as well as diabetes that put you
Okay.
at higher risk for heart disease.
Okay, that makes a lot of sense.
Yeah.
Working harder.
That's right.
Yeah, all right. How about, what, can someone speak to what type of services from a cardiology standpoint are we going to be offering?
Yeah. So again, my focus is general cardiology, but we offer quite a number of services. So often, as mentioned, you'll start with your regular doctor, and then we'll see you, and we can offer stress testing, pretty much all types of stress testing to determine if we think your problem is related to your heart. In addition, we can obtain monitors of various lengths and times to determine if the sensation in your chest that you're feeling that may be uncomfortable is due to a rhythm that could be concerning. So those are some of the main focuses. In addition, we can do CT scanning, which can evaluate the arteries of the heart too, and including medications and whatnot. So quite a wide variety of options we have.
Okay.
Here.
You mentioned stress test.
Mm-hmm.
So can you help us understand a little bit more about that? I think that's often talked about, or someone talking about, maybe I need a stress test, or I'm going
Sure.
to have one. What does that involve?
Yeah, it's a great question. So there's a couple different types of stress tests, but what it boils down to is if we think the symptoms, particularly chest pain, is related to your heart, we're trying to stress the heart to evaluate the likelihood and the potential that this is an arterial problem. If it is something that's caused by a blockage in one of the arteries that could be causing your symptoms, in which we could try to do something to fix that and restore flow to the heart.
Okay.
Yeah,
So it's to help diagnose then if there is a cardiac.
Yeah, correct.
issues.
It often involves a situation where we create a baseline where we start off doing a procedure at rest, and then we compare it to stress. And every time you stress the heart is going to need more nutrients and supply. And if there's a blockage, the likelihood of you getting less is greater if the blockage is significant. And that's the idea of stressing.
Okay. Makes sense.
If it comes back positive, you know, the concern is that there may be a significant blockage where we would probably consider doing a pretty simple but yet very effective procedure called an angiogram, or catheterization, where the vessel is opened up
Okay.
in that manner.
And is that something you do here?
Unfortunately not.
Okay.
I would love that we were able to do it here, but it's something that would have to be done in an outside location.
Okay.
Yeah.
So you would refer someone if they needed
Correct,
something
yeah,
like
yeah.
Okay.
And that, you know, with our affiliation with the university, we have direct access to getting those further services for our patients.
Yeah.
That's a perfect lead in, because that was my next question I wanted to ask about
Perfect.
M-Health. We've talked about that. I see it on your lab
Yeah.
coats, and I know you're both connected or employed by M-Health, Minnesota Health. So maybe you could speak to that and how that relationship works. And
Absolutely.
Absolutely.
okay.
Yeah, it's a blessing to be connected with them. You know, we are a little bit of a distance, but that it provides a door or gateway to every service that could potentially be needed. A lot of times what happens is, you know, there's not the population to support the specialties, and so this gives us that opportunity to have all procedures and all interventions that one could want or need for the patients.
So you mentioned the angiogram earlier.
Yeah.
So if a patient needed an angiogram, you're referring to people that you work with or know?
Yeah, correct.
Okay.
Yeah, we know, I spent, worked with all these people and know them and have, direct contacts and cell phone numbers and, emails and all that information for ease of access. In scheduling too, we have the direct number for scheduling. So it's very streamlined, very efficient way of, providing care.
So then I would seem too, from the standpoint of, as colleagues for you to consult with, you have quite a few to be able to connect with,
Yes.
being part of that university system.
Absolutely, and they are more than eager to help.
Good.
They remind us on a regular basis. We're in contact with them on a regular basis, and they are always willing, any time of the day, to be of assistance.
Yeah.
Yeah.
Great. That is a pretty powerful connection.
Yes.
From the standpoint of the resources that we have access to, and the referral standpoint too. I would assume that it can be done somewhat seamless method, or as seamless as possible.
Right. And like Dr. Brody had spoke about all the different angles and avenues of cardiology for specialization, we have access to all of those services. And with the university, it can be as simple as getting your consultation here in Hibbing, and then going there for the procedure, your angiogram, and coming back and continuing your cardiology care here.
So that's a big advantage. Travel is such a challenge. So if someone did have to leave the community to go down and say have an angiogram, for example, what I heard you say is they're going to come back and be able to be followed by Dr. Brody.
Yeah, absolutely. We try to do as much as we can here and limit the travel time or the need for going elsewhere, but at the same time, it's nice to have those options.
Right. Well, that's a huge advantage.
Right.
So, how about from a standpoint of referrals, and so how does someone, they felt they needed to be seen or evaluated from a cardiology standpoint? How does that happen?
So the process to get a referral to see a cardiologist, we would ask that you see whoever your regular doctor is.
Okay.
Make an appointment with them, and they will determine if you are a patient who should see a cardiologist.
Okay.
And
so it comes from start with their primary care provider.
that's right.
Okay. Great. So where are you seeing patients? I know we have several different clinics, and where are you seeing patients?
We're currently seeing patients here in Hibbing, and also in Grand Rapids at this time.
Okay. So are you going back and forth between Grand Rapids and here?
We are. We have a schedule that's split pretty evenly between the two places, so we have direct coverage pretty much full time for our cardiology services at both sites.
Okay. So, which is great, then both communities get to benefit from the expansion of cardiology services.
That's right.
Okay.
Right.
All right. And then for some may not be aware, but Grand Itasca is part of Fairview, I believe. Is that right?
That's
Yes.
right.
Correct. Yes.
All right.
Yep, as of January 1st.
Right. Okay. So that's a great thing. So they're kind of one of our sister hospitals, if you will. So so you're moving back and forth. I know we have other physicians as well that are going back and forth between Grand Itasca and Fairview clinics here in Hibbing. So it's a great advantage to have that. So,
Absolutely.
anything else in regards to cardiac care, cardiology that we haven't covered that you'd like to share? Anybody?
I think the biggest thing is if you have a concern, if you think you're having chest pain, not to delay, treatment, be seen. And I think we run into the situations a lot where people, it's the middle of the night and they don't want to bother, calling an ambulance or bother people. They're being very kind, but people are there to help. If you wake up, if you're having chest pain, certainly call an ambulance. Don't try to drive. Because they can assess you on scene, and if there was something serious, they can call in and have things prepared, and they can treat you right there and speed the process up. So, if you're having symptoms, certainly go to the ER and be evaluated. If it's during the day, the other option is seeing your primary care physician, but often if it's significant enough, they're going to send you to the ER anyways.
Right.
So it's very important, the sooner the better in those situations.
So we were talking before we started filming the show, and with regards to denial. So is that something you've ever encountered that is common? People having maybe chest pain and just saying, no, I can't be having a cardiac issue or chest pain.
Right.
Yeah, absolutely. it happens a lot where people either they may think it is chest pain, they just don't want to be bothered by it at that time, or they just want to work around it. And it's we say time is muscle. The longer the more time you waste, the more muscle is potentially dying, failing, and so you need to take care of it.
So just to make sure to emphasize that point, so the faster, if there was a heart attack occurring, the faster there's intervention and care given, the less damage
Correct.
to the heart.
Okay. Yeah, correct. Yeah.
So time is of the essence.
It is. Yeah, it's very important.
Okay.
To be very prompt about that.
Good.
And we always encourage people to quit smoking too. It's one of the easiest things you can do. It's very difficult to quit smoking. I mean, there's no question about that. But as far as modifiable risk factors, you can't change who your parents are. Genetics and cholesterol a lot of times is a big deal. Blood pressure is can be treated with medications, but smoking is something that you can step away from it, even though it is hard.
Right. Right. Good. Great
Absolutely,
advice.
Yeah.
Well, we're about out of time. I'd really thank all of you for joining us today and telling us more about cardiology. We're very proud and pleased that we can provide cardiology services to our communities and the patients that need them. And again, as we talked about, the travel is a big issue, and for a lot of people, so having it closer here and available is a tremendous asset. So we're really proud to have you here. So Dr. Brody, thank you.
You're welcome.
Christina,
Thank you.
Susie, and Kristina, thanks
you.
for joining me today.
Thank you.
Thank you for joining us at Fairview Range Focus, and I hope you'll watch next month for another segment. Thanks. Be well.
Thank you.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.